Hi guys, it's Dr. Ron Miller here with cashbasedphysiotherapy.org, and today we're going to go over problem solving. And what problem is a cash-based physiotherapy practice solving? So in any business, you have to solve a problem. Elon Musk and Tesla and Solar City, they're solving the reusable or solar power or energy problem, trying to make cars, with the carbon and trying to master the electric car. SpaceX, if we're staying on Elon Musk, is trying to create a reusable rocket. Any business is a problem solver. So even the guy who made Untuckit.com is solving the problem of guys wearing a dress shirt that's untucked and never fits right. So the question is, what problem is a cash-based physiotherapy practice solving? So first, let's identify the problems and then we'll provide the solutions. So over here is my list of the problems. So let's look at the problems. Problems in healthcare. What is cash-based physiotherapy settings solving? So there's long waiting periods. This is long waiting periods in the waiting room, and this is long waiting periods of waiting weeks and months to even get in to see the specialist. Okay. Another problem is a lot of treatments nowadays are being performed by techs and assistants. This isn't just in physiotherapy, this is in all of medicine. There's more physician assistants being, when the patient's going to receive the service, they're expecting to see the physician or the specialist or the doctor of physiotherapy, and they're getting seen by techs and assistants. That's a problem. 3 is poor patient satisfaction and poor customer service. Let's face it, if you've ever been a patient in a doctor's office, you really don't get the Disney experience when it comes to healthcare. And again, this is not just physiotherapy, this is all of healthcare, that they're lacking the customer service experience. But with the marketplace getting more and more specialized and more competitive, that the clinics are going to stand out, are going to take care of their customers and give their customers a great patient experience. So poor patient satisfaction, and let's face it, how many times have we heard a patient say that they've only saw the physician for 5 minutes and that was it, and he never put their hands on them, never did an eval, and they were in and out the door and they were part of a factory? That's not good patient satisfaction or customer service. Another problem in healthcare is that the cost of healthcare is inflated too much. If an evaluation truly costs $150, how come that if they go to a hospital-based clinic, they charge the insurance companies $500? If you go to a chiropractor, maybe it's $300 or $250. If you come to your physiotherapist, maybe it's $150. So we all know that this is a major problem in healthcare. It's the inflated cost of healthcare. It's way too expensive. 5, whether you realize this or not, more healthcare programs are going towards, or health insurance companies are going towards high deductible based programs for their clients and beneficiaries. So if you have a $5,000 deductible, you're going to have to be aware of what treatment is going to cost this much versus this person says this much. It's going to create a competitive market. But the trend's going to be with, this is just catastrophic plans now, and that if you look at what's going on in the news nowadays with the new healthcare bill being passed, they don't consider physiotherapy essential. Though politicians, insurance companies, lobbyists, they don't see the value in physiotherapy, and they're not going to. So I would not wait around for them to start making changes, because even the new healthcare bill said physiotherapy is not essential. So look at it this way, the future of healthcare is going to be higher deductible healthcare plans, and they're going to be catastrophic plans. So I use the example of this when looking at auto insurance and car insurance. If you get into an accident, it's going to cover the accident if your car is damaged, but your insurance company is not going to cover tire rotations and putting in new tires, oil changes, any kind of maintenance stuff. And that's probably what physiotherapy is going to fall into. So now, if deductibles are going to go up and physiotherapy is not going to be considered essential, where's physiotherapy is going to fit in? So this is where you have to tap into this market, that if a patient has plantar fasciitis and they have a $5,000 deductible, You can go to the hospital-based organization, get imaging that you don't really need probably, get some injections, some pain meds, and told you have foot pain, and they'll send you on your clinic to 3 times a week for 4 weeks. It's going to cost $5,000 easily or more. And the patient's going to have to pay out of pocket for that. Or you can go to your chiropractor. They'll treat you for twice a week for 8 months for $4,000. But if you go to this cash-based physiotherapy practice that will do proven treatments for you, maybe it'll cost $3,000 or $1,800, whatever you end up charging. But you see that you got to take advantage. This is a problem that's occurring, but we can provide a resolution, and a cost-effective resolution in a cash-based clinic. Number 6 is then standard insurance. Insurance companies dictate treatment. They don't have any medical training. There's no reasoning behind this. They just say that they're going to pay for this or not, and they don't have any reasoning behind it. And the insurance companies and money dictates treatment in standard healthcare. In standard physiotherapy, if I see someone 3 times a week for 4 weeks and don't even get them better and bill the crap out of their insurance using 4 to 5 units a visit, that's more money coming into the clinic. Money is incentivizing treatments with this and the insurance companies are in control of the treatment. So they don't really tell you whether it's good or not, but they're in control with that. And number 7 is poor outcomes. Not everything's a poor outcome, but in physiotherapy in general, we can make some true changes in a cash-based clinic and funneling in patients that will best respond to our treatments, give them the best care possible with proven effective treatment interventions and the one-on-one care and get better outcomes. So let's take a next step through and let's look at the solutions. So what problems are we solving in a cash-based physiotherapy practice? So let's go over a few things. 1, we are eliminating the assistant, the techs, and waiting periods. Okay, and it's going to be hard to have PTAs and techs in a cash-based physiotherapy practice. And our practice or our clinics are smaller, more one-on-one care where they don't have the waiting periods. And in my clinic, a patient will have to wait at most a week, if that. But normally I like to get them in the week that they call. And there's no waiting periods in the office anymore, maybe a 5 or 10 minute wait if they come in early. So we're limiting the assistants, techs, and waiting periods. Number 2, we're reducing the cost of healthcare. I'm actually publishing my data right now, my 3-year data with the University of Central Florida, and we're looking at cost effectiveness with low back pain. And we're looking at the research comparing standard care with the many studies already done with the cost of care of standard low back pain cases. And the average cost of low back pain in the year of 2016 for Pursuit was $805. And that was the average. So I'm actually publishing that, but we can actually reduce the cost of healthcare in a cash-based physiotherapy setting. Number 3, we're improving outcomes and patient satisfaction. I don't care whether you're in a factory setting compared to cash-based, there's no way that you're going to be able to compete with patient satisfaction in standard PT healthcare versus a cash-based setting. There's no way around it. The patient satisfaction is going to be much higher in a cash-based physiotherapy setting. And if you're an expert and you can do proven treatments, even your outcomes are going to be better. In standard care, you'll be like 3 times a week for 4 weeks, and that's what your script says, and that's what they're trying to incentivize you to do. In a cash-based setting, you may be able to get that person better twice a week in 2 weeks, pain-free, done in 2 weeks. So we'll have increased outcomes and better patient satisfaction. And 4, a cash-based setting is creating a new cost-effective system that puts the patient's values first. So what is best for the patient, and given their diagnosis, their prognosis, what is best for the patient and what the patient wants is what the patient's going to get in a cash-based setting. So these are the 4 problems that we are solving, and these are the solutions, and why a cash-based physiotherapy clinic is going to answer these healthcare problems and do what's best for our patients in your local area. So let me know if you have any questions. If you want to visit the website, it's cashbasedphysiotherapy.org. Please share this video on your social media and stay tuned till next time. Thanks.